My story per se is going to be on my experience with Asiwaju himself, and specifically to address the health sector, because many people do not seem to understand the role he played in the health sector. And playing that role actually brought out specific competencies in him, specific qualities that I personally feel are required to address the national issue. And I remember there was a particular incident. The cabinet was going to inspect a particular place in Lagos that people had been complaining about. And he said, tell the permanent secretary health to follow us. And I said, I'm not a member of cabinet, but I said, just follow us. All I want you to do is look at this situation from the perspective, of the health perspective, and advise me. And I got into the bus, we got to the place. I hardly walked for 2 minutes. You could even see the disgust in my face of the situation there, and everybody saw it. And I said, what kind of crap is this? He said, that's what I want you to give me a report on what to do to address this. That was the basis he used to stop that issue. And it struck me. He could listen to advice and that kind of thing. So I joined the health sector. And let me say that throughout my stay with him, I still interact with him up till today. There are certain qualities I saw, which unfortunately, many of our youth do not seem to understand it. They don't know this because at that time, probably younger, they were not even born. But these are qualities, again, I felt the stories need to be told. What he did in the health sector for Lagos State. It was during his tenure that Lagos State became #1 in health in this country. Nobody can argue about it. Most people came from other states to understand what we did in the health sector. And part of this is, again, he also fully understands his own limitations. In the sense that, look, I don't have to know everything. But he has this ability to put up a team together to address a specific issue. And that's what he did in the health sector. Some of this is, thinking back, he addressed virtually every function of the health sector that is documented in the books. You see the functions of the health sector. People don't seem to look at this in. One major function is leadership and governance, which is one of the major problems we have in the health system today. And he addressed that by showing leadership and showing governance and restructuring the system for that system to be able to perform effectively. Is key. If there's no leadership, there's no governance, you will not succeed in whatever you want to do. So if you start with leadership and governance, based on his style, he was the first person that I know, my experience, that came up with policies, plans. And I remember we started a 10-point agenda of his administration. For the health sector, he was the one who had the courage to institute a health sector reform. So we ran the system for a couple of years. We still felt that, look, we needed to change. You cannot continue to do the same way you were doing that. So he started with a health sector reform of the health sector, just making the appropriate changes to change the performance of the system. Now produce regulations. You cannot have a system that is not regulated. And look at the health sector as a total system. It doesn't necessarily have to be doctors alone. You can have financial institutions, you can have training institutions, you can have industries, manufacturers. These are all part of that health. So you can imagine the enormity of the system. So you have to regulate the activities of this system. That's the only way you can bring order. It's when you have order that you have vision. People can do what they need to do. So without that, it's chaos. It's one of the problems we have in our nation today. But we did that restructuring. And mind you, effecting changes is a continuous process. You change something to address a particular challenge, but you are making progress and other things come up. So it's a continuous. And those continuous changes requires data collection. You analyze data, you see trend. Where things are going wrong, you stop that. Again, in the course of restructuring the system during the health reform thing, the importance it played to the human resource for health issue is the creation of the Health Services Commission, HSC. If we're going to be Health Management Commission, we decentralize that. We gave each general hospital a bit of relief, let them manage their things, give them responsibility to do, decentralize that system to improve the performance of the system, and converted the Health Management Commission then into Health Service Commission, deals strictly to human resource issues because of value data. And then we recruited more people. We addressed the issue of welfare. It was already time we started building doctors' quarters in different hospitals where there was space, just to address this. More importantly, again, we introduced what we call exchange programs. The specialists from our teaching hospitals, we go to some hospitals abroad just for exposure purposes to learn strategies. It's a way of building capacity within the system. In terms of financing healthcare, you can have leadership and government. If you don't have the proper finances, it's also a major problem in this environment now. At the national level, our health budget compared to total national budget up to now this year is just about 5%. And if you look at the costing, what you need to do to effect a proper health system, it's enormous. So would they will have the wherewithal to raise those necessary funds? It takes somebody who is determined, who values the health sector, that can make changes in that. And I must tell you, during his tenure, one thing he did, we made the approach to him. You need to increase the budgetary allocation to the health sector, which he did without batting an eyelid. Many people do not understand, do not appreciate the enormity of the system. Up till now, we tend to look at the health sector as purely from a curative hospital point of view. You know, everybody says health sector, they say we built 1 million hospitals, is that. But that is just one aspect of that system. And the health sector is large. In most countries, the health sector is an economy, so it's an industry, which we have not really developed in this system. These are some of the things you realize. These are some of the things, again, the continuity of programs in the sector. The plans and programs they started, other governments continued and built upon it. Now, if you go to infrastructure, let's start from the 3 levels of government: primary care, secondary care, tertiary care. In primary care, we set up a policy under leadership and governance that each ward must have a primary health center. Each local government will have a general hospital. And of course, the teaching hospital, the tertiary center, actually started by Maura, his predecessor, because they have decided as a state to establish that facility. That's what inherited. I remember initially we said, are you sure you can fund a teaching hospital in this state? He said it's a political suicide if I stop it. So we have to find a way of dealing with it because it's essential because of population of Lagos State, the Lagos State, which makes sense. So if you look at the primary healthcare system, yes, there were some wards that had PHCs, but I know that during his tenure, he added almost 50 primary care centers extra to the additional. So he increased the number of PHCs from about 160 to almost about 210 or 209, thereabouts. Primary healthcare is the bedrock of any health sector. Priority must be given to primary healthcare. So that basically we set up those policies: 1 PHC per ward, 1 GH per local government. Now, if you look at it again, with hindsight, going back to what he did during that period, because of his commitment to the health sector, he approved general recruitment to the system, health system, starting from primary care level, secondary care, tertiary care. We also know the human resource requirement for a teaching hospital. Brought in specialists, approved them so that at least they can be able to teach, train, and provide a specialty service. In terms of programs, there are certain programs we established. You remember, people seem to have forgotten. Blindness prevention program, people called Jide Idris. You start wondering, how did it start? We went to Chicago to look at some of these people who manufacture glasses, because I said there are many people here who are blind. People who don't even see well. And not only old people, including children, school children. So that program started, continued, went all local government areas. Screening. Those of them that require surgery did surgery. Those of them that require glasses gave glasses. Health talks. and it's still going on today. He looked at health sector and poverty. One thing we realized quickly, you cannot have a very good economy without the health sector. Let's speak. We all say it, health is wealth. But when it comes to implementing, we tend to forget and relegate the health sector to the background. We now listen to the economists who they blow the grammar, GDP or something. But when it comes to reality, if you have a healthy workforce, you cannot run a good economy. Let's look at it. We also look at the sector from the point of view of poverty, and some of the programs we established during that period, which is fully supported, are related to poverty issues, and they address most of the public health challenges we had in those days. The disease of poverty, there are certain programs we established because there was a time one of those programs we started. There was what they called limb deformity reconstruction program. People seem to have forgotten. He was driving to the office. At each junction he went, he saw either young children, basically from the poor homes, roaming the streets, most of them having deformities of the legs, everything like that. And some of them, because of stigma, they couldn't go to school. Children. I said, what can we do? I said, most of these are from people with poor homes. And so we came together, designed this program. You can look at the limbs, got the experts together. Which ones can you correct? And mind you, we corrected many. Some of them were able to walk. But for those few ones that we couldn't correct, they gave walking aids, walking sticks, calipers. So we were able to empower some of these people, some of them who went back to school. So, like I said when I started, we cut across all functions of the healthcare system: leadership and governance, human resource issues, healthcare financing, service delivery, etc. But I can simply tell you that there were gains, and because of the continuity of programs culturally established, that subsequent governors picked up this and expanded on some of this. And my take is that with all these competencies that he has shown, these are the same competencies required at the national level to put proper structure to be able to address the system. The system is still not where it should be. Let me put it that way. Gains have been made, but it's serious challenges that everybody keeps saying. But we need somebody who has the courage, who has the knowledge, who has the qualities, who also has the commitment, believe in the health sector to put things into, and somebody again who has demonstrated these characteristics in Lagos State. That is my Asiwaju story.